friends, I am currently working as a nurse at the Shaya Central Medical Hospital in Dubai. My job involves checking the blood pressure and sugar levels of patients in the gynecology department, as these tend to increase during pregnancy. I am responsible for conducting checkups and administering medications to these pregnant women. I have received proper training for this role. Every day, thousands of patients visit the gynecology department, and I perform the same tasks for all of them, after which the senior doctors take over. They treat these women who give birth to healthy babies and are discharged a few days later. However, one day an incident occurred that left all the doctors and nurses in awe. The main character of this incident was a young Palestinian woman. Something miraculous happened while she was giving birth, and to know what happened, watch the video until the end. And friends, if you are new to the channel, please like this video, subscribe, and click the bell icon to get started. One day the woman came to the hospital. As per Dubai's rules, all women must wear a hijab, especially in public places where they might encounter non-Mahram men. The most admirable aspect of this young woman was how beautifully she covered herself from head to toe. No matter how strict a country's laws on covering are, a woman's intention and dedication to adhere to Sharia must be strong. The girl was very young, around 19, 20 years old. She had an innocent look about her, and her husband was standing next to her, which surprised me. He was a tall man, around 6 to 6.5 ft, with a very tough demeanor. It seemed like the girl was afraid of her husband, but she did not show her fear in front of me. After all, I was a stranger. Why would she talk to me about her personal life? Moreover, I always made it a practice never to ask patients about their personal matters. But what surprised me the most was when her dark-skinned husband told me ours is a love marriage. I love my wife very much. I smiled and said, that's very good, but looking at the girl's face, I felt a great deal of pity. Her expression was visibly sad. The man said it was a love marriage, but the tears welling up in the girl's eyes told a different story. She seemed very stressed for some reason, but she could not express her sadness in front of me. After completing all formalities, I asked her, is this the only guardian you have? It's with you, your husband, who will go into the cabin with you. In Dubai, hospitals allow a patient to bring along their husband, child, mother, or mother-in-law into the cabin if they wish. When I asked her this question, she said, I don't want anyone inside with me, not even my husband. I asked her again, and she replied, I prefer to undergo all medical treatments alone. I don't like being with anyone, not even my husband. The girl firmly responded and stopped her husband right there. The man seemed very angry, but they couldn't cause any trouble in front of us. I noticed that he was internally suppressing his anger. The girl looked familiar to me, as if I had seen her somewhere before. There was a strange sense of kinship in her face. I prepared the checkup room and helped her onto the bed. She looked around with a sense of wonder, as if seeing everything for the first time. I asked, what's your name? She replied, Tanya. Hashim Zad. I asked gently, are you very worried about something? You can tell me if you don't mind. She requested, could I have a prayer rug? I need to perform and I want my child to come into this world in a state of purity, and I want to be pure too. I will do as much as I can and leave the rest to Allah to guide my child through the right path. Tanya's manner and innocent look captivated me. I fetched a prayer rug from the staff room. Seeing the rug, she was delighted, though it wasn't possible for her to perform prayers on the floor. In her condition, she said, I just want to touch the prayer rug to my head, to my face. As she kissed the prayer rug passionately, I asked, would you like some help? She replied, no, I don't want anything else, but please make sure my husband doesn't come inside. And who will deliver my baby? I told her about Dr. Nash, a renowned Israeli doctor here, known for his skill and popularity with appointments nearly it's impossible to secure. As per the schedule, Dr. Nash was supposed to perform her surgery, and she was his patient for that time. slot when I mentioned Dr. Nash. Tanya responded, "Is he a male doctor? Will a man conduct my delivery?" I reassured her, "Yes, and you're very fortunate to be treated by Dr. Newer. Most deliveries are done by female doctors who may not be as skilled as him. Since Dr. Nash will be handling your case, you have nothing to worry about. Your treatment will be well taken care of, and you will also be protected from post-delivery complications." She objected, "I don't want a man to see me in that condition. I have lived my life in modesty, never showing even my face to a man. How can I expose myself before a man?" Now I explained, "It's different with doctors. They are professionals in their eyes. Patients are just humans, not differentiated by gender." She insisted, "Please don't say that. There's definitely a difference. Why else would a man study gynecology if not for an interest in women? Please talk to them and ask for a female doctor to conduct my delivery. Otherwise, I won't have my treatment here. I'll go home." I was astonished by her words, especially since she was just half an hour away from delivery, and it was almost time for her anesthesia. Although the situation was challenging, I didn't want my words to cause her blood pressure to spike. I left the cabin and headed towards Dr. Nash's office, located just across my corridor. He had just arrived at the hospital and was preparing for the next case. It seemed he had never before encountered a patient who refused treatment from him. Everyone, including their guardians, was usually very pleased if Dr. Nash was assigned to their case, but Tanya's behavior was unusual. Despite my explanations, she adamantly refused to be treated by Dr. New. "Hush," I went and explained everything to him, and he too was taken aback. He was a professional doctor of Jewish descent with connections in Israel, but he had never discriminated in his treatment of any patient. Despite all his qualifications, Tanya did not want to be treated by any male doctor. Dr. Nash looked at me thoughtfully and asked, "Who is this patient? Can you introduce me to her? Who is she to refuse treatment from me? I think she might need mental care. No female patient in this hospital has ever said anything like this. Why would she?" His intense interest in the patient seemed unusual to me. I had never seen him show such concern for any other patient. "Where is she from?" he asked. I replied, "The girl is Palestinian, from the city of Hebron. She is extremely beautiful and seems fearful. It's strange because her husband has very dark skin, not typical for a Palestinian. It looks like they were forced into marriage. His appearance suggests he might be Arab, yet his physique and height could indicate he is African." We were talking as we walked down the corridor towards Tanya's cabin. When we entered, we found the cabin empty. The bed was unoccupied. I looked at Dr. Nash in confusion and exclaimed, Where is Tanya? She was supposed to have her delivery in half an hour. She was in a critical condition. Miss Zainab, please arrange to find the patient quickly. Otherwise, our hospital's reputation will be at stake if she has fled out of fear. You can't imagine what might happen. This is the age of social media. Even the smallest matter can go viral nowadays. Our hospital has a reputation to maintain. It's one of the best in Dubai, which not only reflects on our staff but also on our community, the director said. His words made me worry too. I thoroughly searched the entire cabin and even the bathroom, but Tanya was nowhere to be found. Searching for her became increasingly difficult for me. After all, she was 9 months pregnant. She couldn't have gone far too quickly. Finally, I confided everything to Dr. Nash. He said, immediately notify the hospital technician, check all the cameras thoroughly, especially the one outside this cabin. She was here just 10 minutes ago. Where could she have gone in such a short time? We both rushed to the technician's room and asked him to check the cameras. After reviewing all the hospital's camera footage, we learned that Tanya had left the hospital just moments ago. However, her way of walking was very strange. She walked as if she had no baby in her womb, as if she had already delivered. She was also carrying the brown bag in which she had brought her belongings. Dr. Nash and I were shocked. We observed her carefully. She walked as if she was a virgin. We zoomed in on the footage over and over but could not understand where had her baby bump gone. Dr. Nash pointed out the disappearance of the baby bump. Then I also observed Tanya carefully. Her stomach really looked like that of a normal woman, as if the baby had vanished from her womb. Where had the baby gone? I don't understand. Where did the girl go? Strange, the doctor exclaimed. There were no cameras in the labor room, so we couldn't see the footage inside, and I hadn't allowed any other nurse to enter the cabin because Tanya wanted to be alone. Dr. Nash was very worried. Where had Tanya's baby gone? If she had given birth, how and when did the baby come? And where had the baby gone? We couldn't understand any of it. We went to the labor room again and checked everything thoroughly. There was no baby, no brown bag, and no tan. After reviewing the footage, we learned that Tanya had left the hospital at 1:30. There was no way for us to trace her, but fortunately, when the incident occurred, we noticed that Tanya was heading towards a mosque located near the hospital. This was also very strange, because in such a condition it is not usual for a woman to go to a mosque. No one would have thought, seeing Tanya leaving the hospital, that she had been a pregnant woman just moments before. However, I was also worried about this, but then finding answers to all these questions became very difficult. When we went to the mosque, we learned that she had not been there either. This area was better known as the hospital's rest area rather than the mosque itself. People who accompanied patients often waited outside this mosque. Prayer mats were always available inside for those who wished to pray while waiting. However, we started searching for Tanya from the mosque but found no trace of her. As we continued our search, it soon turned to CPM and my shift ended. I thought about going home, considering that if I encountered Tanya on the way, I would definitely speak to her. It seemed to me that Tanya had not gone far. She must be around somewhere. In her condition, she couldn't have gone far. I felt she was nearby, and indeed she was. As I was leaving the hospital and